Welcome Home, a podcast for veterans, about veterans by veterans, is a project of Willing Warriors and the Warrior Retreat at Bull Run.
Good morning. I'm Larry Ziliak, Director of Culinary Services here at the Warrior Retreat, your host for the Welcome Home podcast. And today we have a great guest, Luke Frazza, who is with the Dulles Area Transportation Association. He's a program outreach manager, and he's here to talk to us about their programs for veterans. So, Luke, welcome to the podcast.
Thanks, Larry. I am honored to be here. Since I came out, my first time coming out for the Vets for Vets last year, I was blown away with your property, but more importantly, your mission of what you do. And I had the opportunity to talk to some of your clients who had come through while they were looking at some Corvettes. And it was just so inspirational to hear how their family got a break from the strife that they were trapped in elsewhere and just got a little hiatus out here to pause the difficulties.
Yeah, it's a beautiful property, and it's a big property. So that's one of the benefits, is that allows us to have that amazing car show. And we were so glad that you were able to set up a table here, an information table. Hope it was productive for you.
It was.
Good. So tell us a little bit about the veteran-centric programs that the agency has started and how they can help.
Absolutely. So just a little history. The Dulles Area Transportation Association, thankfully more commonly known as DATA, started as a business association in the Dulles corridor to have a say on smart development. But over the last 10 years or more, we have split our focus to working with businesses as well as working with underserved populations.
Okay.
That includes people who have English language challenges, elderly, and disabled. And we have federal funding that is specifically targeted to the disabled and 65 or older.
Okay.
So I came on about 3 years ago. I come from a communication background, and I came on, and one of my colleagues had just come back from a conference where they talked about a veterans volunteer driver program. Now, there is an amazing program that exists in Northern Virginia called NV Rides, of which we are partners with, who recruit neighbors to drive other neighbors to doctor's appointments and grocery stores.
Okay.
But when Sarah, my colleague, came back from this, someone talked about making it a veteran-centric, about veterans or even veteran supporters driving veterans. It would be twofold in benefits. First, veterans, as we all know, are the last to ask for help.
Sure.
So we thought having a veteran in the front seat would cajole some of these folks out of their isolation to avail themselves of this project.
Yeah.
And I can tell you firsthand, when you are looking for volunteers, when you mention veterans, the response is magical. So in fact, when we launched this program, the first volunteer we got said, "I'm not a veteran, but my dad was and my grandpa was. Can I still volunteer?" Of course, the answer is yes.
Yeah.
And we said this is a program of inclusion, not exclusion. But because it's under the NV Rides umbrella,
Okay.
it also, when the people call in and say, "I want to come in on the Veterans Connect," they say, "Absolutely, that's great." And then they say, "Would you also consider, if you're free one day, driving Mrs. Smith, who's not a veteran, who still has to get to dialysis?" And of course, the answer is almost always yes.
Sure. And so I'm clear, so our listeners are clear. Your organization doesn't provide the rides. You provide the volunteers, and place them with organizations that do provide the rides? Is that
It's exactly correct.
okay?
So the NV Ride system, which this is under, is a network of service providers. In Prince William County, it's Volunteer Prince William. In Loudoun County, it's Loudoun Volunteer Caregivers. In Fairfax County, it's a number of Shepherd Centers and some other organizations who are all recruiting volunteers. They, in addition to recruiting volunteers, they get the ride requests.
Okay.
Which, as you might imagine, always outstrip capacity of available volunteers.
Sure.
What data has done, when we talked to NV Rides, we identified two niches that were not being addressed. One is the veterans. They had no veteran-specific component. The other is folks who don't speak English so well, so we have a separate program that focuses on bilingual volunteer drivers.
Okay.
And in both cases, and when I was out here had my card table set up at Vets for Vets,
Right.
I'm looking for volunteers. And if you were to come up and say, I'd like to volunteer, and I say, where do you live? And you say Manassas. I said, okay, I'm going to send you to Volunteer Prince William. And you're going to use your own car, and you're going to help an elderly veteran. So also, all for this program, all of the clients are ambulatory. So these are not people in wheelchairs and people who need to be carried or helped put into a car, because our volunteers aren't trained for that.
Sure.
So those are not the people you're going to help. It has been a success.
Yeah.
And
like you say, underserved population. You know, as you get older, the keys are taken away, but you still need to go grocery shopping. You still need to go to medical appointments, and it also helps with isolation because, you know, if there's a veteran driving, they're most likely talking to their passenger, another veteran, about their service, where they were stationed, about all their problems with the back office and everything they had during their military career, and bonding. I would guess that there are times when veterans want to drive certain veterans, or
a bond is created.
Yeah, and a client asks for a particular driver.
To your point, a few months ago, I had the honor of going out. Jan Hawkins, who runs Volunteer Prince William, who is one of our partners and an Army veteran herself. She runs a fantastic program in Prince William, and she's doing not only veterans, but veteran spouses, because what's happening is, you know, a lot of veterans are passing away and leaving their spouses with no one to help.
Sure.
So some of the programs have wrapped this in and consider it the same thing of honoring those who served, because we all know that the wife served,
Sure,
just like the husband, keeping the home fires.
The whole family.
Right.
Yeah.
So I had the pleasure of going out and interviewing a veteran driver with his passenger, who was a client, and it was at a doctor's office in Manassas, and it was an 88-year-old Air Force veteran who was down to sight in one eye, and he said his network to get to the doctor's appointment was a friend who had just passed away.
Oh, yeah.
And he said, my daughter lives 40 miles away. She takes me once in a while, but she works. That's not convenient. So he said the bond that has built with the driver has just been amazing. And in addition to doctor's appointments, they normally then go get coffee or lunch.
Right.
And he said, I now look forward to these appointments because we have so much in common. We can talk about similar backgrounds and experiences. And that's, like I said, that's how it was designed on the whiteboard.
Yeah.
To build these. And he said he's had other drivers as well as this one he's connected with, but he said almost every time we don't part as just driver and client. He said we part as comrades.
Yeah.
And there's just a special connection.
Yeah. And it's almost like some of the VSOs out there have buddy check programs.
Exactly
And
right.
it's basically the same thing. if you have that bond and you're picking up the same client, you can look at their whether or not they're disheveled, whether or not they're getting thinner, whether or not talk to them about other issues that they might have.
That's absolutely right.
Yeah, and also where you're picking them up from. What does the house look like now as opposed to last time? Are there other services that they could use, like who's mowing the grass?
Right.
Maybe even, do you have enough to eat?
Exactly.
So there's anytime volunteers can come in contact with a veteran, especially an elderly veteran, and I talked to Molly Brooks at Heroes Bridge about this, is that the people that are putting the eyes on the veteran are extremely valuable because they can see things that the rest of us don't see. You see that veteran in their own environment. There's things to look at there
where they're not putting on a public facade,
right?
And like you to others, I'm fine. Other people need it more than me.
Yes, and they're not going to ask for help, and so, I think that those veteran volunteer drivers are so important. What's the need out there? I mean, how many are needed, do you think?
Well, I can tell you, I think last year we recruited about 36 or so, and it wasn't even scratching the surface.
Right.
And the need accelerates every day. Since we've started this program and I work on it, I get calls from other people who aren't veterans or who are veterans who need, I need a ride tomorrow morning. Do you have something for me? And unfortunately for that person, this is not a spontaneous kind of ride situation. And for all the reasons you were talking about earlier, the service organizations want to do an intake of every client so they can help them with their 360 needs.
Sure.
So they don't just get a call and say, they won't give you a ride if you say, I have a 3:00 doctor's appointment.
Yeah.
They want to talk to you. Well, tell us about your housing. Tell us about who takes care of you. So transportation is one component they're helping you with.
Right.
During COVID, because of some of the work we were already doing under the Federal Transportation Administration grant, there was an opportunity for a micro project to help veterans get to COVID shots.
Oh.
So we partnered with the Northern Virginia Veterans Association, who already was helping 400 plus veterans with a number of things, life quality things, and said, hey, let's work together. And instead of going to look for participants, she said, we're checking in with these people every day.
Yeah.
So just because of the way it worked out, by the time we hammered out the details, most people had been vaccinated, but they said, I'm still 6 months behind on my care with the VA and other things. And my support system vaporized because my daughter, who used to drive me, was afraid of killing me, bringing something in to me. And the volunteer program, understandably, everybody stepped back and hit a pause because we didn't fully understand what was going on. So as soon as we got authorization to make it any healthcare appointment, the floodgates opened. And in about 14 months, we delivered 1,600 free taxi rides for veterans to healthcare appointments.
Sure.
And one of our biggest success stories was a veteran in Prince William County that needed to go to the VA in West Virginia. The cab waited for him, and then took him home.
Yeah.
I mean, I can't imagine. Well, I think I saw the bill. It's probably approaching $300.
At least. And I'll tell you what, that's where I go for my care. Originally, I started with the VA in D.C., but we're basically about 32 miles from the D.C. and VA hospital. But it takes you, because of traffic, the same amount of time for me to drive 78 miles to Martinsburg to get care, and it's a prettier ride.
Understood.
So I understand that's a good way to go.
And he was coming from Dumfries or something.
Yeah, so that adds another half an hour easily.
Right.
Wow, that's a great.
We couldn't have been prouder of that project and our partners at Nova Veterans who were doing the heavy lifting of matching the rides and making sure if something got canceled and they would say, okay, it's not this, now it's pushed back, or I'm going to be longer. And the cab company that helped us was completely on board in flexibility. Dominion Transportation. It was just a wonderful project.
Right.
But because it was a special COVID fund,
right, it's over.
We lost funding.
Yeah.
But what that taught us is transportation is a healthcare issue.
Oh, yeah.
And not everybody thinks about that. You can have the best healthcare in the world, but if you can't get there, what's the point?
Yeah.
So it also, to pick up the slack, we now have, the Veterans Connect people. So people who had not been involved with Veterans Connect before, who had the taxi rides, now we are recommending call Veterans Connect, get in our system. We can help you. We can't pick up all of the slack,
right?
But there's a lot that we can do there.
Yeah. And so what we experienced here at the Warrior Retreat when COVID hit is we lost a tremendous amount of volunteers. And a lot of that was because our volunteer pool tended to be a lot of retired or newly retired people. And so they were actually in a high-risk group.
Of course.
And so we understood why they were stepping back. Now, what we found is that they're slowly coming back to us. Do you see the same thing?
Yes. Yeah. It was recruiting for a while was very difficult. So we had pivoted to doing food delivery to these same people because the food banks were now not permitting people to come.
Right.
So that was a way to help people as we could and give people a volunteer opportunity that they were less scared of.
Right.
And in fact, my daughter did it where she went to the food bank, got a couple boxes, would put them on somebody's doorstep,
ring the doorbell,
step back. And, the woman was crying, thanking her for delivering
I think of some of the people that I saw when I went out during COVID, because I would go out and grocery shop, and I would see these people who would complain nonstop about having to wear a mask, having to do this. And I think you don't know how lucky you have it. There are elderly people out there. There are veterans. There's that underserved population that is really getting hit hard because the food bank wouldn't let them come.
Understood.
It's just people just don't see it. And I really applaud your organization for being out there and saying that transportation is a healthcare issue.
It is.
People need to look at it differently. That's the only way it's really going to get more funding. It's the only way that health providers are going to hopefully get on board and see it and say, we either have to fund it or we have to integrate it into what we do. But
we have heard that from them, the people who are much lower level than the policymakers in the C-suite of the insurance companies. But they said, yeah, we get what you're doing, and we're trying to integrate it as part of healthcare delivery.
Sure.
Because same thing, if they can't get to us, what's the point?
Yeah. Yeah. So, and I think that for some time, their approach to that had been to buy a big bus, and fill it full of nurses and doctors and drive it to what they thought was an underserved community in an inner city somewhere. And that was the answer. But really, the answer is to fund programs like yours that are willing to do the heavy lifting, that have the contacts in the community and say, you provide the care, we'll provide
we'll get the patients.
We'll get the patient to you.
Yeah.
And I just don't understand why that's hard for them to see.
Well, anytime you do, we've always done it this way.
Yeah. Right.
But what is it going to cost me? So all those things. But I want to tell you about something else we do, because we are always, I mentioned to you basically what we do, we boil down to mobility for all. And we're working every day in a number of ways. We also do travel training. So we will, in Northern Virginia, we're Reston based, we will go out to a veteran's home, to an elderly or disabled veteran, and we will map out where they need to go. Then we will walk them to the bus stop, show them how to use an app to plan what bus you get on and when. And then if they want to get to the metro, we will take the bus to the metro, show them that, how to use the metro card at, smart trip card at the metro, how to ride the metro. We go one stop one way, one stop the other way, and take them home. Or take them to, I need to know how to get to the community healthcare center.
Right.
Easy. We'll do that. So we have a travel trainer who is he's travel savant. It's just crazy.
The amount of patience that must take.
Oh, he just spouts it and lives it and loves it. So he is magical with these folks of how to do it, showing them how to do it. And the thing that caught me is we did one recently, not with a veteran, but with some, we're doing some low income folks who don't speak English in Centerville and Herndon and helping them similarly. But when we got to the metro, first thing before they got on the escalator, he said, "Stop. I got to show you the safety hazards of riding this escalator. If you're in flip-flops or if you have a coat hanging down or a bag hanging down." So it's to that detail to keep everybody safe to use that. But there are people who have a bus stop at the corner who have never ridden the bus.
Right.
And if they are fit enough to do that, we want to help them, encompass that and integrate it into their life.
Is there support for those folks in purchasing transportation, like tickets for the bus? Or
There can be.
Yeah.
There are some subsidies. Fairfax County has a subsidy that is fantastic, and they change. But
Right.
Fairfax County has a website that has their latest programs on it. Where, well, for one thing, I'm sorry, backing up, Metro has a senior card that is a lower rate, but Fairfax County, better than that, has a couple different programs where it was one where you pay $15 and you get $100 balance. Another, that was for seniors. For other folks who are underserved, you pay $20 and get $100.
Wow.
So what people were doing was spending either $60 or $80 to get a $400 card.
Wow.
So,
Wow. That's a pretty good program.
right.
Yeah. And unfortunately, these programs are funded by the government, federal, local, state programs, and funding always runs out. So where are you guys at as far as funding goes? Are you finding it a struggle, or are the partnerships strong?
I would say the partnerships are strong. We have an amazing network of both federal and local funders, as well as private foundations. We got a fantastic grant from the Community Foundation for Northern Virginia, saw what we were doing, and gave us a 2-year grant.
Nice.
And what's really important about that is to go after some of these government projects, there's a 20% match. So when they say, we'll award you 100, they're really awarding you 80 and you got to come up with 20.
Right.
So coming up with that 20% is a challenge, but we have gotten private funding from local philanthropic groups who are happy to help us with that. Northwest Federal Credit Union, big supporter. They're helped so many people in the community, and they had a program where they wanted to give money, and they asked the employees, different departments, decide where do you want us to send it.
Yeah.
And one of their departments sent it to us to help with all our veteran stuff.
Wow.
And so that's
great.
pretty rewarding that the message is getting through.
Yeah. Yeah.
And they're a big sponsor of we have a golf tournament coming up in Friday, September 29.
Okay.
And this will be the third it's like the 30-second golf tournament data has put on, but this will be the third year that it's been focused on veterans transportation.
Okay.
So we call it Drive for Veterans.
Okay.
And
I like it.
It's to focus, draw attention to, as well as fund efforts to combat the growing veteran transportation crisis. And our co-sponsors are Northern Virginia Veterans Association, they're a leader in this field. They do white papers. They're out, and together we've been able to do such great things.
Yeah. Do you see this program replicated in other parts of the country?
I'm not sure. I have had visitors come up to when we go to farmers markets and other things to recruit volunteers and set up a tent. And I've had people say, I'm from St. Louis and I wish we had something like that there.
Yeah.
It's sometimes they exist and people don't know.
Right.
Even in this area,
I know.
as savvy.
People are clueless.
Right.
Yeah.
Right. If you're not reaching their channel, you're not getting through. But I will say our great partner, Emily, who runs the Northern Virginia
Angela.
Not Angela.
Not Angela.
Angela runs Northern Virginia Veterans Association.
Yes, president.
NV Rides, wrong organization.
Oh, okay.
So NV Rides, who is the mother umbrella of Veterans Connect, was invited to the Virginia Governor's Conference on Aging to talk about veterans programs.
Right.
And Emily asked me to go down with her, and we gave a presentation talking about this, how to reach veterans as well as to get more volunteers to drive veterans.
Right. If somebody wants to volunteer, how do they reach out to you?
So they can call me at 703-819-3459. That's my cell phone.
Okay.
And they can also go to our Facebook page, serves as our website. We don't have a standalone website.
Right.
But it's Veterans Connect
on Facebook.
On Facebook.
Okay.
And you'll see it. It's in the Reston area. And there's an application there.
Okay.
Or you can email me at Frazza. That's L as in Larry, F as in Frank, R as in Ranger, A as in Apple, Z as in Zulu, Z as in Zulu, A as in Apple, at datatrans.org.
Okay.
DATATRANS.org.
Okay. And if somebody, it's not likely a veteran's going to call up and say that they need help, but if somebody knows of a veteran who needs assistance, what's the best way for them to find that help, especially from a transportation standpoint? What's the best organization they should reach out to?
Well, NV Rides has an amazing system where if you go to nvrides.org and it says need a ride, you click on that and up comes a map that is color coded. And in each color coded area, if you click on the name of the service org, the contact information comes up.
Okay. So if
you say I live in Vienna,
right,
you're going to see the green shading, click on it. Shepherd Center of Northern Virginia is going to pop up with their phone number.
Perfect. I don't think it could be any easier.
That's a great place to start for the volunteer ride. It's always a good idea. I tell everybody that they should be calling Northern Virginia, Angela's group, Northern Virginia Veterans Association. Her team with Melissa and their ride managers are always good because they can send people to NV Rides, but they're going to also do that holistic intake where they're going to say, okay, I'll see if you should call them. Tell me about where do you get your food?
Yeah.
How do you shop? All those other things.
Yeah.
So they're really good at that.
And part of the veteran having to go through the intake is, even from a transportation standpoint, is that they're really talking about one-off appointments. Usually you can't make an appointment with a doctor today without some sort of follow-up.
Right.
So that way it's easier for them to line up additional rides in the future for you, because they can schedule it out. You know, you got that appointment in 6 months. Well, we can schedule the ride out.
It's a wonderful program.
Yeah.
And it might not help you for that appointment you have at 2 p.m. tomorrow.
Yeah.
But call anyway, because to your point, it's going to help for those subsequent appointments and to get your blood sugar checked or your dialysis or all those other things, which we know are maintenance.
Yeah, they're going to be part of the show.
And if I may, so when you say you want to volunteer, I send you to the service organization closest to where you live, because I don't want you driving all over Northern Virginia.
Yes.
So then that organization, once I hand you off, I'm out of the equation. A representative from that organization will reach out to you, do a background check, because we want to know that we wouldn't ever put somebody in a car with somebody who isn't safe.
Well, let me ask you, stop you right there. If you're a female veteran, can you request a female veteran driver or a female driver?
I will be honest that I have never heard that come up before.
Okay.
I think you can request anything.
Right.
That would be
based on availability then.
I can't speak for the organizations, because the organizations under the NV Rides umbrella, who are also our Veterans Connect partners,
right,
they each have their own way of doing it. There isn't a uniform on everyone.
Right.
So I would never speak for how they work. But so one thing
possibility then. Yeah.
You can ask.
Yeah.
And I just don't, but everyone's going to be different based on, they might not have any female drivers.
Sure. Understandable.
So what I was going to say though, what is so great about the Veterans Connect and the bigger for the NV Rides program is that it is a volunteer friendly system. Unlike a lot of volunteerism that is every Tuesday at 10 or every other Saturday at 3. This is when you are available to help. So most of the programs have a system where once you have been vetted and you're in the program as a volunteer, you and every other volunteer will get an email that says the next week or 2 weeks, these are all the rides that we need. Mm-hmm. Mary Smith, she lives here, she's going here, it's expected to take this long. If you can help, you click on it, claim that ride, and you're good.
Yeah.
If you can't, you let that email blow by and you're not on the spot.
Sure.
So it's really volunteer friendly.
Yeah.
And people like that flexibility. Oh, I got a light load coming up. I can do 4 rides this week.
Yeah.
Oh, I'm going out of town, or my grandkids are coming in. I can't drive for those 2 weeks.
Right.
It's whatever you can do, because even the smallest bit helps somebody.
Sure. And in the end, with volunteer organizations, the easier you make it for somebody to volunteer, the more likely they will be to volunteer and the longer they will volunteer.
Absolutely.
For sure.
Absolutely. And they have really struck a nice balance on that front.
Yeah. Oh, that's great. Well, listen, Luke, this has been amazing. I really appreciate you stopping by and telling us all about the program, because it's so important, and the work you guys are doing is just fantastic. And so thank you so much for coming.
Well, back at you for good works. I mean, it's different, but what you do out here is purely inspirational. And I wish everybody could come out and see it. And I would implore them to come out and visit if there's a volunteer recruitment or an open house or something, because you just really do something special out here. And while it might be half an hour from Fort Belvoir or somewhere else, you might as well be a million miles away.
Yeah, it's beautiful country out here.
Just letting people have some normalcy for a while and forget all the baggage of the other stuff.
Yeah, for sure. And so at a minimum, you can come out next year for the Vets for Vets show and talk to Luke at his table, because we're going to have him out again. To all listeners, thank you so much. And we'll have another episode next Monday morning at 5 a.m. Until then, thanks for listening.
The Welcome Home podcast is brought to you by Willing Warriors, a nonprofit organization serving active duty service members and veterans since 2012. To learn more, please visit our webpage at willingwarriors.org.